Chronic obstructive pulmonary disease or COPD. COPD is a group of lung diseases that includes chronic bronchitis and emphysema. Many people with COPD have both of these conditions. Over time, these lung diseases block airflow and make it difficult to breathe. Emphysema slowly destroys air sacs in the lungs, which interferes with outward airflow. Bronchitis causes inflammation of the bronchial tubes, which allows mucus to build up. COPD is the third leading cause of death. COPD is a common, preventable, and treatable chronic lung disease which affects men and women worldwide. Damage to the lungs from COPD can't be reversed, but medication and lifestyle changes can help you manage the symptoms. Causes. The main cause of COPD is smoking, but non-smokers can get COPD too. Most people with COPD are at least 40 years old and have at least some history of smoking. The longer and more tobacco products you smoke, the greater your risk of COPD is. Approximately 85 to 90% of COPD cases are caused by smoking. Tobacco smoke irritates airways, triggering inflammation that narrows the airways. Other causes include occupational exposure to chemicals and fumes, frequent use of a cooking fire, severe respiratory infections, and alpha 1 antitrypsin deficiency. Pathophysiology. COPD results from airway inflammation and narrowing of the airways. This leads to lack of airflow and destruction of alveoli, bronchioles, capillary vessels, and tissues, which adds to airflow limitation. Reduced airflow on exhalation leads to air trapping, resulting in reduced inspiratory capacity, which may cause breathlessness on exertion and reduced physical capacity. Symptoms. Many people don't recognize the symptoms of COPD until later stages of the disease. Symptoms include shortness of breath, wheezing, or a chronic cough. Shortness of breath can be an important symptom of lung disease. Symptoms may be mild at first, beginning with intermittent coughing and shortness of breath. As it progresses, symptoms can become more constant to where it can become increasingly difficult to breathe. COPD symptoms include chronic cough with or without mucus, shortness of breath that gets worse with mild activity, frequent respiratory infections, difficulty taking a deep breath, chest tightness, fatigue, wheezing. In later stages of COPD, symptoms may also include blueness of the lips or fingernail beds, swelling of the feet, ankles, or legs, weight loss. Untreated COPD can lead to a faster progression of disease, heart problems, and worsening respiratory infections. Stages of COPD. COPD can gradually get worse. How fast it progresses from mild to severe varies from person to person. Stage 1 or mild COPD. The first sign of COPD is often feeling out of breath with light exercise and a cough with mucus. At this stage, lungs are functioning at 80% or more of their normal capacity, and many people don't realize they have COPD. Stage 2 or moderate COPD. Airflow restriction becomes more apparent. Coughing and sputum production may increase, and you may experience more intense shortness of breath during physical activity. At this stage, the lung function has dropped to 50 to 79% of normal functioning. Stage 3 or severe COPD. You may experience shortness of breath and become fatigued during everyday activities. Also, you may experience increased mucus production and discoloration. At this stage, you become more prone to lung infections, and the lungs are functioning at between 30 to 49% of normal capacity. You may have more than one exacerbation per year and have been in the hospital due to COPD. Stage 4 or very severe COPD. This stage of COPD limits your mobility. You may have severe breathing problems even when resting. Every activity can cause shortness of breath. You may need supplemental oxygen from a portable tank. Frequent hospitalization may be needed. In severe COPD, your lungs are functioning at less than 30% of normal capacity. Exacerbations occur more often and may require emergency medical attention. Diagnosis. Diagnosis is based on symptoms, complete health history, a physical exam, and diagnostic test results. Your doctor will want to know if you smoke or have smoked in the past, are exposed to secondhand smoke, air pollution, chemicals, or dust, have symptoms such as shortness of breath, chronic cough, or mucus, have family members who have had COPD or any other respiratory conditions. Physical exam and tests. During the physical exam, your doctor will use a stethoscope to listen to your lungs as you breathe, check vital signs, and observe feet and ankles for swelling. Based on all this information, he may order some other tests to get a more complete picture. Electrocardiogram to check heart function and rule out heart disease as a cause of shortness of breath. Spirometry. The best test for COPD is a lung function test called spirometry. It's a non-invasive test to assess lung function. Lung function tests measure the amount of air you can inhale and exhale and whether your lungs deliver enough oxygen to your blood. During the test, you will take a deep breath and then blow into a tube connected to the spirometer. The machine measures the amount of air you hold and blow out and how fast you can blow it. Other tests include measurement of lung volume, 6-minute walk test, and pulse oximetry. Imaging tests like chest X-ray or CT scan may be ordered. With an X-ray, the lungs may look normal even when a person has COPD. A CT scan will usually show signs of COPD. Sometimes a blood test called arterial blood gas may be done to measure the amounts of oxygen and carbon dioxide in the blood. This involves taking a blood sample from an artery. This test can show how well your lungs are able to move oxygen into your blood and remove carbon dioxide from your blood. Thank you.